I remember the first day I was able to say that I'm an RN. What's up, guys? It's Haitian Melanin back with another video. And this video, you guys, I have a whole bunch of questions that my friends sent me about nursing that I'm gonna be answering. If you guys wanna watch this video to get some insight on nursing, my experience, all of that good stuff, nursing school, then keep on watching, okay? So first question, how hard was it for you to get a job as a new grad? Honestly, it wasn't hard at all. Like, I had 2 jobs that wanted me, actually 3. It really wasn't difficult. Like, a lot of these people, they want to hire new grads. Like, it just depends on the unit that you want to go to as a new grad. But a lot of these jobs are willing to just take you. Like I know my unit is filled with no grads, but it wasn't hard at all to get a new job. What floor do you work on and what do you like and dislike about it? So I work on the cardiac unit. It's a cardiac interventional unit. It's basically a unit where patients who go gets a pacemaker done, patient who's had a STEMI, patient that has AFib, like any heart rhythm issues, heart attacks, chest pain, anything related to the heart to fix that issue is what my unit is on. It's like step down unit. I love this unit. Like, it's very terrifying. Don't get me wrong. Sometimes I feel like maybe I'm in the ICU unit. It's an intermediate unit, which is a great start for me because I do want to work in the CVICU one day. So I feel like it's a great start for me. Cardiovascular was what always grasped my attention. Like, I love cardiovascular. And nursing school was the same thing. The cardiovascular topic was like one of my favorite things. I was just so mesmerized by it. And for the last like 3 semesters of nursing school, that's all the unit, like that was the unit that I used to do my clinicals in. So I feel like God was low-key aligning me to follow cardiac because it's just like, 1, I liked it, and 2, like everything was just aligning. Like, even where I did my practicum before graduating nursing school was the cardiac unit. So I feel like it was just meant to be. What I like about the cardiac unit is because I feel like you get to see different types of patients, because you get to see patients with stomach issues. You get to see patients with like urinary issues. Like, if one thing goes wrong with the patient's heart rhythm or heart, automatically they send it to our floor. Like, it's just anything that has to do with the heart, they just like quickly just send it to our unit. So we get to see all sorts of patients, which I love. So I feel like in my unit I'm always gonna learn something new. I'm always gonna grow my knowledge in different organs of the body. So I feel like, I'm always gonna learn something. What I dislike about the unit is how easy is it for these patients to lose their life. Like, it's literally like you in the middle of them in the grave. Like, it's that serious. I hate, how some patients can be in so many drips at once. I know this is what the ICU would consist of, but I wanted to gradually work myself into that. But it's like, it kind of started off as like full force, like boom, 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 like, which I don't mind. It's just, it takes a lot, mentally and physically, for me to get adjusted to that, especially as a new grad. But I've learned so many things thus far, and it's only been 6 months. So imagine me being in that unit for another 6 months. The next question is, what are some pros and cons that you have as a nurse? Some pros is obviously you being able to care for people My thing is, before becoming a nurse, I wanted to care for people, yes, but you could care for someone anyhow. Like if you go into business, that's you helping somebody. If you go into technician or freaking plumber, that's you helping somebody. So there's so many different ways that you can help someone. But me, I love learning about the body. So low key, I'm a nerd. I'm a geek. So it's like nursing gives me the opportunity to always grow my knowledge. It gives me the opportunity to care for people, just like the way that I want to care for them, not just helping people, but like to help and care for their body. I love the pay. That's a pro. Freaking making 3-4 times as much than I used to make. The opportunities that nursing gives, the different units, the different things you can do. Like you can open up your own clinic, you can be an instructor. You could go, if you don't like the cardiac unit, you could go to oncology. If you don't like oncology, you could go to dialysis. Like it's just so many, or you could go to peds. Like it's just so many opportunities, so many different routes that you can take as a nurse. And I'm pretty sure there's more routes out there. Like there is outpatient, there is out-home nurse, like HHA, nursing home. Like there's just so many different, it's not just one thing. Like you have several different opportunities to do what you love in a different environment. So that's what I really love about nursing. A con is, depending on the unit that you work at, how toxic it can be. And if you don't really know how to work in, if you don't really know how to work as a group or as a team, that can really take a toll on your shift, because nursing is about working in a team. If your team is trash, your night is going to be trash, because you're only one person and you're not going to be everywhere at once. But at least if you have a good team that would help you with your patients, that would, help. Like I remember I was stuck in a patient room giving blood, and I had another patient that heart rate, and blood pressure was completely out of whack. Like the blood pressure was so low and the heart rate was so high, I couldn't be in both rooms at the same time. So my teammates had to be in that room for me as I'm giving the blood. Like it's stuff like that. It's teamwork that's gonna make your shift much better. So definitely knowing how to be a good teammate, and having a good team behind you to help you when you're in trouble. Another con is, I feel like nursing school don't really prepare you well for the actual world. They just teach you the basics, but I wish that I don't know, I just feel like the transition from nursing school and actual nursing was kind of like a blur, because I don't know, I feel like it was a foundation, but it really didn't. I don't know how to explain it. How does it feel to introduce yourself as a nurse? Ooh, it feels so amazing, you guys. Some days it feels really amazing. Hey, I'm gonna be your nurse today. I feel so confidently saying it. And other days I'm hi, I'm gonna be your nurse today. It feels amazing. It just depends on the mood that I was in before coming into work. And if I start myself on a good note, the night will be good. But yeah, it feels good. And it feels good walking around with my scrub on. And yeah, especially when I wear my cardigan to work, my long cardigan, I be feeling like a boss woman, okay? I be feeling good. I be feeling like my body looking good in my freaking scrubs. I be feeling good, okay? Introduce myself as a nurse. And when I'm out and I'm doing applications and they ask me what's what's my job occupation, being able to put registered nurse. I remember the first day I was able to say that I'm an RN. That felt so freaking amazing. Like, I'm an RN. Like, I've been wanting this for the past 10 years and I'm literally living in a dream. Like, it felt so like surreal and good. Do you feel like nursing school prepared you for the real world? I kind of answered this question. I feel like nursing school did, but not really. They just set up the bare minimum. And it's up to you to keep growing that knowledge. And me, I'm going to keep growing my knowledge. If there's one thing about me, I'm going to keep asking questions, watch videos, because I want to grasp all of the knowledge that's out there. I literally have a notebook that has a whole bunch of stuff that I write of what I learned at the unit. So yeah, nursing school set you for the bare minimum, but you have to want it to be like that boss, like that bad, like boss nurse. So I feel like they did what they could do. I mean, there's so many units and so many different things out there that you have to know as a nurse. So I feel like for the most part, they just touched up a little bit on every organ in the body. But is your life easier or more stressful after becoming a nurse? That actually is a great question. Is my life easier or more stressful after becoming a nurse? I feel like in some aspects my life is easier, but in other aspects it's much more stressful. I feel like easier in terms of my goals and aspiration in life. I feel like they're actually reachable this time. The opportunities that I have making the amount of money that I make opens up so many doors for me. I feel like nursing will really set you off. Like, you can use your nursing income to open up a business. You can use your nursing income, like, to buy a house, for different things. So I feel like, yes, it kind of put me in a position to have better opportunities and to do more with my life. But stressful because you are caring for patients. You have to know what is considered like what's tolerable or not for you. Like me, like I constantly worry about like, okay, like, is this assignment safe? Is it not? Caring for myself outside of work. Like being competent, being content, like that's the part where it's like much more stressful. Am I being taken advantage of? Like, what do I do? Like, I need to protect my license. So it's like, that's the aspect that is much more stressful. It's like everything involving work. But as for me, as a night shift person, I feel like my life did become stressful. Only because I feel like everything is revolving around work, because I'm always at work. And if I'm not, I'm sleeping. So in that aspect, yes. But when I have like a couple of days off and I get to enjoy my days off, I feel good. I mean, I'm making the amount of money that I need to make. And then I have like a good amount of days off. So I'm able to like revert to regular sleeping schedule. I'm tired. You see, it's 2 a.m. and I'm tired. Thank goodness. Because as a night shift nurse, you don't get that easily. But yeah. But after you get adjusted to that schedule, boom, you right back in night shift. But yeah, I'm sorry, guys. I'm not giving energy right now. I'm a little bit tired. But thank you so much for watching this video. If you have more questions for me, please don't forget to add it in the comment down below. Don't forget to like, comment, and subscribe to this channel. And let me know any other videos that you guys would like to see from me. Don't forget to stay cute, stay classy and positive, and I'll see you guys in the next video.